They were doctors, they were scientists, and they killed, not by accident, not by chance. They injected, cut, electrocuted, mutilated, drugged, isolated, and experimented on men, women, and children, without anesthesia, without remorse. Every scream, every torment, every death was a protocol. Every smile, every calm word behind the white coat hid the horror. Mengele, Chlorberg, Ishri, Oberhuser, Gottlieb, Cameron, names that sound like doctors, but whose actions were the cold embodiment of barbarity. Josef Mengele, born in 1911 in a bourgeois German family, fascinated from childhood by genetics and human anomalies, developed very early an obsession with twins. Studying medicine and anthropology, he combined scientific rigor and charisma, dreaming of discovering universal biological laws, completely ignoring human suffering. At Auschwitz, he walked through the barracks every morning, choosing his victims, grabbing children by the arms and brutally separating them from their mothers, noting every physical detail, eye color, limb length, reactions to touch, injecting chemicals into veins, abdomen, or directly into organs to cause disease, infection, or paralysis. He performed amputations, sterilizations, and lethal injections, sometimes simultaneously on several subjects, without anesthesia, observing spasms, convulsions, fever, and loss of consciousness. While noting the screams and moans as mere scientific data, a chilling anecdote reports that he sometimes forced twins to walk naked in the snow to study the effect of extreme cold, noting their resistance and the appearance of severe frostbite. In the evening he returned to a normal life, played the piano, read, and talked with colleagues, escaped capture after the war, and lived under false identities in South America until his accidental drowning in 1979. Never repenting. Karl Chlorberg, a gynecologist born in 1898, before the war recognized for helping couples conceive, became a methodical executioner at Auschwitz, attaching women to cold tables, injecting corrosive chemicals into their uterus, causing internal burns, hemorrhages, infections, and permanent sterility, some screaming for hours, writhing in pain or fainting, some dying on the table. He experimented with different concentrations, varied protocols, sometimes on several women simultaneously, observing every spasm and vomiting carefully, repeating experiments until he considered the results satisfactory. A horrifying anecdote recounts that he preserved some organs in jars to compare the effects of the chemicals, meticulously noting every detail in his notebooks. Every evening he resumed his normal life, dined, read, and talked, and after the war, although briefly arrested, he escaped justice and died in 1957 of a heart attack. Convinced of the scientific legitimacy of his actions, Shiro Ishii, born in 1892 in Japan, led Unit 731, turning prisoners, children, and pregnant women into living guinea pigs, every day supervising vivisections without anesthesia, injections of deadly bacteria, exposure to freezing, extreme heat, decompression, cutting of organs and tissues to observe disease progression, infections, and death, the victims screaming, fainting, or dying slowly while blood flowed through the laboratories. He performed organ transfers, systematic mutilations, sometimes on twins or pregnant women to study disease transmission. A chilling anecdote recounts that Ishii made prisoners walk naked through icy puddles to induce pneumonia and hypothermia, noting every shiver and convulsion. In the evening he returned home, laughed, talked with his family, and lived normally. After the war he negotiated immunity in exchange for the collected data and died in 1959 at age 67. Unpunished, Herter Oberhuser, born in 1911 in Cologne, entered Ravensbrück as a young ambitious doctor, initially motivated by career and prestige. Quickly confronted with sick prisoners, she began performing atrocious medical experiments, opening wounds on women's legs or arms, inserting shards of glass, metal, or even dirt into the flesh. Sometimes closing the wound or leaving it to fester to observe infection and gangrene. A survivor recounted that Oberhuser sometimes listened to the sound of bones and torn tissues, noting every moan or scream as if it were scientific data. She also injected chemicals directly into the wounds, causing burns and necrosis, observing meticulously the body's reaction, spasms, and pain. Oberhuser often performed these experiments in groups, with several prisoners lined up on cold tables, comparing the progression of infections from one victim to another. A chilling anecdote reported by witnesses describes her observing women screaming because of shards of glass in their flesh, taking detailed notes while calmly talking to her assistants. After the war, convicted of war crimes but released early, she resumed civilian medical practice, lived her life normally, and died in 1978, never showing remorse, convinced her actions were scientific. Sidney Gottlieb, an American chemist born in 1918, responsible for the CIA's MKUltra project, obsessed with controlling the human mind, organized experiments where subjects were exposed to massive doses of LSD, sensory deprivation, prolonged isolation, and repeated suggestions. A precise anecdote recounts that Gottlieb placed subjects in soundproof rooms plunged into complete darkness for weeks, monitoring them only via cameras or instruments, noting every reaction: tremors, hallucinations, desperate screams, self-mutilation. He also tested forced social interactions, observing paranoia and fear develop, recording reactions to analyze the effects of mental manipulation. Some subjects became unable to speak or mutilated themselves, others completely lost touch with reality. Despite the horror of his experiments, Gottlieb returned home every evening, led a normal family life, talked with colleagues, or watched television, unpunished. He died in 1999, never confronted his victims, his cruelty residing in the methodical and invisible psychic destruction inflicted from a distance. Ewan Cameron, a Scottish psychiatrist born in 1901. Fascinated by mind control and personality reconstruction, plunged his patients into prolonged comas for weeks, administered massive repeated electroshocks, often dozens per session, causing confusion, disorientation, memory loss, and progressive destruction of identity. He also practiced extreme sensory deprivation, isolating patients in total darkness, depriving them of food and stimulation, exposing them to repeated subliminal audio recordings until their psyche fractured. A chilling anecdote describes patients awakened after weeks of unconsciousness, confused and terrified, unable to recognize loved ones, subjected to new rounds of shocks and isolation to reinforce effectiveness. A Cameron meticulously documented everything, treating distress, tears, and screams as data, each evening returning to his normal life, interacting with family and colleagues. Dying in 1967, never confronted his victims, leaving behind thousands of mentally destroyed lives, with patients unable to function socially or professionally. They disappeared, some free, some dead, some in prison, but their acts remain. The mutilated bodies, broken minds, destroyed lives still speak. Science was only a mask, the white coat a facade. Behind it, there was only methodical cruelty, cold calculation, absolute indifference to human suffering. Mengele, Chlorberg, Ishii, Oberhuser, Gottlieb, Cameron, names engraved in horror, and the world cannot forget.